What pisses you off about the PCOS advice that people throw online? Like, what makes you angry?
Oh, I'm an angry dietitian. I should be named the angry dietitian.
Is it a hormone problem or more of an insulin problem? Does everybody gain weight on PCOS? Do some people lose weight on PCOS?
We have a dietitian actually in we don't claim her. We don't claim her in our profession. All dietitians will say that. Just lose weight, just lose weight.
Hey guys, and welcome back to It's Pretty Simple. It has been a long time since I have put out an episode, and it's just because I've been super busy traveling everywhere, and it's almost been impossible, but I'm back, and I've got some great episodes lined up for this season. Starting with this first one, I have a guest with me, Sana. She's actually my childhood friend. We have literally grown up together. I think she knows me since I was born. Sana specializes in PCOS. She's a PCOS dietitian. I'm going to let her take over and give you a brief on what it is that she does. Hey, Sana.
Hi, Nick. It's nice being on your podcast.
I'm so excited to have you here.
Yes, we've come a long way.
We have. Do you want to give us a brief?
Yes, absolutely. So my name is Sana, and I'm a PCOS weight loss dietitian. I'm registered in Canada. I work with women all over the world. And one of the things I specifically like doing is working with women who come from different cultural backgrounds and teaching them how they can still eat the foods they grew up eating and still sort of see symptom approval and basically move their PCOS into remission without honestly giving up their culture. I don't think you need to abandon your culture or your sort of cultural foods in order to sort of achieve your health goals. So that's like me in a nutshell.
That's great. Yeah, that makes a lot of sense. I mean, I work with a lot of people from India, and like it's always been a struggle for me because I don't really understand the cultural foods there, in terms of how to like make it diet friendly, for example. So
you would
yeah,
know more about Middle Eastern eating,
exactly,
right? Yeah,
or like the Mediterranean diet. But yeah,
yes.
that's a really good take on it. So the first question I actually want to get to before we get into the details is what pisses you off about the PCOS advice that people throw online? Like, what makes you angry?
I'm an angry dietitian. I should be named the angry dietitian because every time I'm scrolling, I'm just like fuming with the things I see. But honestly, I think there's a few of those things that really piss me off. Number one being the blanket statement of just lose weight and your PCOS will disappear, or your PCOS will like magically fix itself. I don't think people understand that the PCOS is what's causing the weight gain. It's not the weight gain that just sort of causes PCOS, right? So just sort of understanding that PCOS is very complex and just throwing words out like that just lose weight, just lose weight. Even doctors are guilty of doing that because they have like 10 minutes with their patients and they'd be like, oh, you just need to lose weight, right? Meanwhile, this client might be having an eating disorder and she's already eating the least amount of food possible, but then you're constantly sort of sending those messages to women, right? So that is probably one of the ones that I hate the most. And I think the second one, because I'm also such a carb lover, I'm not biased, but talking about how like you need to cut out carbs or just villainizing carbohydrates in general for managing your PCOS is the other thing, right? Because again, it all sort of like the messaging on social media where it keeps telling you, oh, cut out carbs, or carbs are bad for you. You can't eat a piece of fruit, blah, blah, blah. Yeah. Guess what it's doing? It's honestly really changing your relationship with food. So these women who are already dealing with all these symptoms, they're now having this other issue that they're having to worry about is food fear. That then leads to binge eating or eating disorders or right? And that actually takes them further and further away from their goal in terms of like managing their symptoms. So that's the annoying part. In social media, there's so many good things about it, but I think people want that like factor, or they like, they just spew shit just to capture attention, but not having to like, no one wants to listen to the boring science aspect, right? So I think we're all guilty to get stuck sometimes in that loop. So
that's for sure. I think there's a lot of misinformation because you've got the influencers and then you have the actual educated people,
regulated professionals,
like dietitians, people who have certifications to back them up, and then you have the influencers, and
Yep.
more and more people for some reason seem to be listening to influencers nowadays. And when it comes to carbs, I think it's an overall thing, even for just general fat loss, because it's easy to make somebody stop carbs because they're definitely going to lose weight.
It's easy. Honestly, that is such a good thing that you've mentioned, because we have a dietitian actually in, we don't claim her. We don't claim her in our profession. All dietitians will say that, but she promotes just gluten-free, dairy-free, because that worked for her. Great that it worked for you. But the whole idea of going through dietetic school and, being a regulated profession who wants to just provide proper evidence-based information, you can't just be like, oh, just do this. But why are they doing it? It's because it's so easy, because she has a huge population. And how can you help all of them all at once? Be like, you know what? Just cut out carbs, or just cut out dairy. And they're just doing their own thing right in the background. And yes, they're losing weight. They're seeing some changes, but I don't know how long or where that's taking them, right? Because again, when you think about a lot of like your carbs, or even gluten-free carbs, there's a lot of fiber in some of those things, right? So you're missing out on some key nutrients as well. But yeah, it's just easy to control the mass population when you just say, well, just cut this out and you'll be fine.
I mean, initially, I think when you cut out carbs, like, you will lose weight very quickly within the first 2 weeks, but you're losing water weight
and muscle mass, right?
and muscle mass. But this is why I think that's why it's easy for them to say, because like, oh my God, this is actually working.
Exactly. And they capture them in that first month where they have these like amazing reviews that, oh my God, this works. Yes. Okay.
You could do it. I can do it, and
absolutely.
we would have like some amazing first and second week results. But yeah, definitely. Okay. Coming back to PCOS, like, what is something right now that's being praised online? Like, not like we've talked about the carbs, but like with PCOS that, according to you, is complete nonsense.
So things that don't work for PCOS, but that
it's getting praised. Like people are talking about how it's working well, but it's not actually.
I mean, I think like the most common ones are the standard, like just going gluten-free and dairy-free. That's probably the most popular ones. What else? We've talked about the carbs. Those are cutting out carbs, cutting out gluten, cutting out dairy. But if you look at the research for dairy as well, it depends on what kind of dairy you're consuming, right? So it's, again, easy to just say, just cut out dairy. No one's talking about how women have such a high rate of osteoporosis, and cutting out that major calcium source, which also absorbs very differently than supplements or other foods, for example, like vegetables and things like that have calcium. It's very different. It works very differently. But when you're cutting that out, you're also now setting yourself up for bone disease as you're aging, right? Your hips and your knees ain't gonna function the same way, right? In your 20s, when you cut it out, it's fine. You don't see the side effects of it. So that's really key. And talking about dairy, it's the type of dairy that matters. So if you're eating good quality dairy, which are fermented or high protein, like Greek yogurt, cottage cheese, there's excellent research supporting how it's pro-fertility. So it improves your fertility outcomes, right? And when other dietitians like myself who talk about, well, you need to incorporate it. We're not saying that eat dairy at breakfast, lunch, dinner. We're not saying replace everything with dairy. You need at least 1 to 2 servings to meet your calcium requirements for the day. And then again, the protein that comes with dairy, it's very different. It has like the whey and the casein, which actually helps you stay a lot more fuller, right? So there's so many other benefits of dairy. With gluten, honestly, I think, of course, if you're celiac, like I have clients who are celiac, of course you need to cut it out. Like there's no this and that or reduce gluten, blah, blah, blah. But for the general population, I would say majority of my clients, if you even take a look at, the progress I share or clients' feedback or reviews, they're all clients who are including dairy and gluten in their diet and seeing results, right? So I would say probably a small percentage of clients who cut back or reduce gluten. And that's a very specific situation where if I notice that their labs are showing excessively high C-reactive protein, or they have a thyroid antibody issue, then I might ask them to reduce it. And not because I think, or the research is saying that gluten is causing these issues. We're just really simplifying the diet. That's it. We're just really simplifying it, giving your body a little bit of calmness before we sort of like introduce it. And also, they're not eating 0% gluten free. It's like 80% gluten free. They still include 20% for like social stuff and whatnot. And again, I can literally count those clients on my fingers because that's how limited they are.
Yeah. So
Yeah.
this whole thing of everyone being gluten intolerant and cutting out gluten, there was a whole
No,
fad that happened for ages.
no,
That's bullshit.
exactly. And also, I think a lot of people confuse gluten intolerance, or they're like, oh, I just don't feel good, or I just get really bloated. It's because your gut bacteria needs work. Like you need to work on your gut health, not just take these things out. You want to build your bacteria that does a good job in digesting your food. So that's the problem most of the people are having, or they will have like their eating pattern is so sporadic that there's such long gaps that it's causing so much gas in the stomach, right? And then
Mhm.
they'll be like, oh, the next time I ate something, no one's sitting and keeping records of like patterns, right?
Yeah, that's true. I mean, I actually went through this myself where I
Yeah.
thought I was gluten intolerant, and then I did the test and I wasn't. And I was just constantly bloated, but it was
Yeah.
the
Yeah,
quality of
you've mentioned this
food.
before to me. Yes.
Yeah, quality of food. And then I moved from Kuwait to Spain,
Yeah.
and no bloating anymore. Just
How interesting.
I'm having barely any processed food. Like
That's a big
going
part,
to the
right?
market, fresh fruits. There's no preservatives in anything,
Yeah.
and so
You
it's
don't
made a
even need to
big
sit there
difference.
reading labels. You don't even need to bother doing that
No,
because
I
literally
don't need to do
everything
that.
is whole foods.
It's all local. It's all
Yeah.
locally sourced, so it's great. Yeah. Okay, so coming to PCOS, for people who don't understand it and they're interested in listening to this
Mhm.
episode, if we strip away all the noise, what is PCOS? Is it a hormone problem or more of an insulin problem? Does everybody gain weight on PCOS? Do some people lose weight on PCOS?
Yeah. I mean, to be honest, I would define PCOS as a metabolic issue, metabolic syndrome, essentially, because you have the insulin aspect that's driving a lot of these symptoms. And yeah, it's metabolic than anything else. And that is what then causes all the other symptoms. So when women are like losing their periods, it's not just because they have a gynecological issue. It's the fact that, oh, the insulin is telling your ovaries or communicating with your ovaries to make more testosterone. Now your androgen levels are elevated, which is affecting your LH and FSH ratio. So now your periods are going missing. So it's very complex. It's not like black and white that, oh, this is causing this symptom, this is causing this symptom, or this. Insulin will cause so many other issues, right? Same thing with like when your nervous system is dysregulated. Again, your diet again can be very, very good, but you can still see all the symptoms if you're constantly in fight and flight mode, which
Mhm.
honestly half our population now is just how our world works, right? So it's very complex. That's how I like to describe PCOS. And I always tell my clients the good news though is you don't have to do different things to manage all the different symptoms. You just
Mhm.
got to lay your foundation. Your foundation being working on your blood sugar management. So making sure you're eating the right sort of dosage of carbs per meal, getting the right amount of protein, getting the right amount of fiber, nutrient dense, like antioxidant rich fruits, vegetables, things like that. Knowing that, okay, what's a good caloric range? Because that's the other thing where a lot of times clients think they need to be under eating so much for PCOS, right? But when I sort of like do all the calculation and they're like, I'm on 1800, I'm like, yeah, I have clients on 24 to 2600 for their weight loss zone. So everyone's so different.
Mhm.
So you want to just be on a slight deficit because yes, that will help promote your fat loss and preserve your muscle. And then figuring out what's a good sort of ratio for you, that how much protein, not everybody needs 30, 35 grams. Leaner clients don't need that much because if they're going to eat that much, they're going to start to gain weight because they probably only need like 50 grams. If you're 50 kgs, you only need 50 grams minimum protein. If you're 55 kgs, you need 55 grams, right? So you don't need to be eating 100 grams that you would see on social media that, oh, you should hit your 100 grams. You need to hit your 100 grams because protein also has calories. So just sort of understanding like your nutrition, like personalized to you is really important when it comes to PCOS. What was the other thing you asked me actually?
The other thing that I asked you was, does everybody gain
Gain
weight
weight. Yeah.
on it?
So there are two types, right? We have women who gain weight because of PCOS, and then we have the lean type as well, where even though there is no weight to lose, if you really look deeply, there is still a lot of visceral fat in the midsection. So it's kind of like that skinny fat,
Mhm.
essentially, right? So there's still inflammation with lean women who have PCOS. There is still insulin resistance, but the major driver with lean women is the adrenal glands. So there's a
Okay.
huge nervous system component with lean PCOS type. And then when it
Okay.
comes to women who need to manage their weight, or they're gaining weight uncontrollably, then of course there's also the insulin, there's the nervous, there's again that whole component, but just their body's responding a little differently, right? It's just our body types are different, but it
Okay.
still shows up. The symptoms are very similar. Like you will still be have issues with sleeping. You still have fatigue in the morning, right? Throughout the day, you still have blood sugar crashes in the afternoons, right? So you're still having hair loss. You're still having facial. So the symptoms are very similar. It's just the weight aspect's a little different.
Hmm.
But yeah, they still experience the same symptoms.
But not everyone with PCOS is going to have all the same symptoms.
Yeah, it's a combo. It's like everyone comes with like a different combination, right? And again, you would then need to look at, okay, what is their lifestyle looking like? What is their eating habits? What is their relationship with stress, right? There's so many of those things you kind of need to see. That's why I actually only do one-on-one coaching rather than doing like massive groups, because
Mm.
I think I have control issues as well. And I'm like, I want to make sure everyone's like getting the exact help, because I don't like generalizing everything. I mean, yes, there can be some general elements that, hey, eat to keep your sugars balanced. But again, each person needs different protein. Each person needs different dosage of carbs. Each person needs different amount of fats, right? So
Yeah.
that's really hard to like just, just make it standard, I guess.
Yeah, for sure. I mean, I think in any case, PCOS or not, that every person is extremely unique because, people have very different lifestyles. And like you said, the stress and
Exactly.
everything comes into play for everybody. But talking with women with PCOS, do they need a special diet in comparison to somebody who just wants to lose some weight? So let's say you have somebody who's overweight, right?
Mm-hmm.
And then you have who doesn't have PCOS, and then you have somebody who has PCOS and is overweight. Would their diets have to look different?
That's a good question. I think I know exactly what you're getting to. So the way I explain to say potential clients or when I'm working with someone, if a woman does not have hormonal issues and they don't have PCOS, right? They don't even have to worry about any of that stuff. All they need to do is lose weight. The calorie in, calorie out works fine. And you can do whatever ratios you want for carbs. You can have a higher carb percentage, but stay within your calorie deficit, and you will lose weight no problem. If you don't have insulin resistance and you don't have those hormonal issues, right? But if you're working with someone who has severe insulin resistance, they have PCOS, which again, the insulin resistance driving so many things, the calorie deficit alone is not helpful.
Okay.
Does that make sense? So you can be in a calorie deficit, but if your carb ratio is still over what your body can handle in that one sitting, it still is going to have that spike in blood sugars and then that drop. And then your still body's making that much more insulin. Our whole goal is trying to calm your pancreas down so it's not having to make all that insulin. That's the main thing with women who are trying to lose weight. If you have PCOS, that spikes are really important. And it doesn't mean you don't need a spike when people are like, okay, just cut out carbs. I'm like, you're not dead. You need your blood sugars to rise up, but how high is it rising up? And that depends on the dose of the carb. So it doesn't matter how healthy a carb is. Like you could be eating like, I don't know, like 60 grams of like chickpeas in terms of like carbs, like 60 grams of carbs from chickpeas, or you could be eating 30 grams of carbs from chickpeas. Even though they are healthy, that dosage will matter,
Yeah.
because just because it's healthy and has full of fiber doesn't mean your blood sugar is not going to rise that much higher, even with the most healthiest food. So even figuring out, okay, for my sweet potato or my lentils and my beans and my chickpeas, what is the right dosage that I should be eating?
Mhm.
It's not unlimited just because it's healthy,
Yeah.
because we're trying to minimize those, like how high it goes, right? And then kind of come back down in a normal fashion. Then it's stable for some time before your next meal. So we're trying to regulate that as much. And when you're doing that, it also brings down inflammation, because insulin is deeply connected to increasing inflammation as well.
Yeah.
Of course, as you're gaining more weight, those fat cells are also producing inflammatory, what do you call it, cytokines, right? So it's literally the foundation of how you eat. You can't just follow anyone's diet who's just
Okay.
trying to lose weight.
Well, when you're talking about the insulin spikes happening from eating carbs, this would happen to a regular person who does
It
not have
would.
PCOS either.
Yes.
Yeah. So, like, I mean, at least in my case,
Yes.
what I do with everybody that I train is before any meal, have some greens. And
That's
that
a
way
great
we try
hack.
to stabilize it.
That is a great hack. But in terms of like for women who don't have insulin resistance, their body is a lot better at sort of utilizing all that glucose because their insulin, the amount of insulin your body's producing, the cells are responding really well to it. So if
Mm,
all your cells open up, all that extra carbs that you're eating, which is
then,
now broken down to glucose, is getting used up. There's no issues. There's no glitch. Like that's how I
yeah,
explain it. There's no glitch. But with women who have hormonal issues and insulin resistant, and also there's the genetic component, which is again why I work with a lot of women who, you know, come from different cultural backgrounds. And if you really look at that, their genetic type is such that they are genetically prone to being insulin resistant as well. So,
okay,
but their
that's
diet hasn't
interesting.
adapted, right? The
Whoa.
diet hasn't adapted to like how our society is built now. Back then, because they were like, for example, Indian
I was
or
just gonna
South
ask
Asian.
you, give me an example.
Yeah. So like South Asians, like if you look at our ancestors, farmers, right? Farmers, gatherers, like just farming for hours and hours. And so if you look at the Indian diet, it's so carb heavy, which is fine because they only come back by the end of the day after they've left home. So they eat so much like that lentils and rice and like have a high carb diet, but then off they go in the fields and it's all getting utilized, right? No
Mm,
issues. But now we're like sitting in front of a computer eating like a granola bar, which has like, I don't know how much sugar, and we're not moving, but our
mhm,
diet hasn't adapted,
yeah,
right? So we can fit everything. We can still be eating a dal and rice and all that, but we need to still just adapt it to now how we live. Our activity levels have gone down. Now we have to plan to go to the gym. It's not just happening incidentally,
yeah,
right? So those things, once you adjust it, your cultural diets can fit. You just need to figure out the amounts and how to mix match your foods.
makes sense. Okay, insulin resistance. So this is predominantly the main issue with PCOS, right?
Insulin
Causes.
resistance, yeah. Yes, it's insulin resistance, but people automatically just think that insulin resistance is all to do with food habits and how we eat.
Hmm.
But I mentioned this earlier where you could literally be eating even low carb diet
Yeah.
and your body could be making so much insulin if your nervous system is a wreck. And what I mean by that is like if you have history of trauma, you have chronic stress in life, you're in like go go go, all of those things will still make your body make so much insulin
Okay.
independent
Yeah.
of any carbs going into your system. So
Okay.
yeah, that can drive a lot. Yeah.
So what's the difference, and like what happens to the what happens when insulin is released in somebody with PCOS versus somebody without PCOS?
That's really good. Simplifying things. So it's a really good educational question. Okay. So, for example, when we eat carbohydrates, right? Let's talk about just normal digestion and how it works. You break it down, your body, starts to release glucose. So once your carbs have been digested into glucose, it's going to be in your bloodstream. Now, as soon as your body detects glucose in your bloodstream, it's going to signal to your pancreas, letting it know that, hey, we have glucose here, send out insulin. So insulin will get released. Now, insulin is like a key, and your cells have locks in them. And in order for you to use the glucose that you've eaten now, your cells need to actually open in order for your glucose to move into the cells, and then it gets used once it's in the cell, right? And that's the job of insulin. It opens, it opens, it opens. So that's the normal way it works, right?
Hmm.
And then you're fine. Like it gets utilized. Now, with women who have insulin resistance, for whatever reason, it's either that your body has been making a lot of insulin for a really long time, maybe again, because of stress, because of high intake of carbs, not eating enough, under eating. There's so many reasons.
Hmm.
Eventually your body, your cells and your key, they don't work anymore. So they stop responding. Your cells stop responding to the insulin key.
Okay.
So a lot of those cells stay closed. And so even though there's the same amount of glucose now circulating in your bloodstream, a lot of these cells are closed and there's no way this glucose can move into the cell. So again, the fatigue comes from there because you're not able to utilize energy efficiently. And then we have a backup system. So your liver is like, oh shit, there's still so much glucose in this person's bloodstream. Why is it not going anywhere? Oh, okay, maybe they don't need it. Cool. They will convert that glucose into fats and start storing it. And so this is where that second phase, that fatty liver phase starts to happen when there's constant storage, but not enough time to basically utilize that stored fat.
Okay. And when this process is happening where the insulin is not opening up for,
The cells,
for
yeah.
the glucose to go and like
Hmm.
actually be used, at the same time, I would assume cortisol levels are rising as well.
Yeah, they actually work hand in hand too, like cortisol and insulin.
Mm.
They do. So, again, just talking about the nervous system, when your body's making all that cortisol, your insulin also starts to go up because your body's starting to break down its own glycogen to release glucose. So, there's that other source of glucose also coming into your bloodstream. So, yeah,
Mm.
there's a connection there too.
Heavy, heavy. So coming to cortisol, cortisol rising, more insulin, glucose, all of this, I want to come to training.
Yeah.
I know you're a dietitian, but I know you also know
Yeah.
about
Yeah.
training. HIIT and PCOS.
Hmm.
So HIIT normally, whether it's it does take your cortisol up, but so does
Temporarily, right?
most
And it
training,
comes back
right?
down. Yeah. Yeah.
So, but a lot of people say that if you have PCOS, stay away from doing HIIT
Again,
completely.
this is the social media aspect. This is what we should have discussed right at the beginning when you asked what you hate so much about social media. But let's like break it down a bit, okay? So for people who really want to understand, should they be doing HIIT? Should they not be doing HIIT? Like, what's the deal? HIIT is a fantastic exercise for people who don't have much time, right? So because you just need to do it for short, like 28 minutes tops. Like nothing is longer than 30 minutes essentially for HIIT training, right? And it works really well. Yes, it temporarily increases your cortisol, but it brings it back down. Great to use up your testosterone and all of those things. That there's nothing wrong with HIIT training in general. Now let's look at you as a person. Like if I was someone who undereats already, because I'm like trying to manage my PCOS, my weight, blah blah. I'm already under eating. I have my lifestyle is like full of stress, so I'm chronically stressed. Okay, my sleep is already off, part of the PCOS symptom, right? You're not
Mm.
sleeping well, so the recovery is so poor, right? And then on top of that, we're going and doing HIIT, 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 HIIT.
Mm.
It's not going to work.
No.
It's not going to work for someone. Yeah, it's not going to work like it works for someone else who does not have all these issues. So you really need to look at yourself and don't compare to other people who are like, oh, don't do HIIT, don't do HIIT, don't do HIIT.
No.
You definitely can, but you need to build your stress resilience first. So work on your nervous system, make sure you're eating enough, right? If you're eating enough and if you're doing HIIT, you're fine. And also you're doing a combination. You're not doing just HIIT all the time. That's the other part. I really recommend clients to sort of incorporate a little bit of everything versus just over focusing on one thing. Same thing with strength training. It's so good, but that's not all you need,
Mm-hmm.
right?
Yeah.
So the NEAT is a really important piece. So like, are you getting enough movement, day-to-day steps? Maybe you do 1 or 2 HIIT sessions, great for your cardiovascular fitness. 2 days, maybe you're doing strength training, right? So you got to have like a range,
But
not
if you
one
were to
versus
choose,
others. Mm-hmm.
if you were to choose between HIIT and LIS for somebody
To
with
start off with,
PCOS,
I would say LIS.
LIS,
Yeah,
right?
to start off with, definitely. I would say start off with walking consistently, like an hour every day. And once you feel like your body has adapted, then you can challenge yourself. So then even like incline walks are fantastic. And again, you don't need to jump to 12, just
Mm.
a little increase, a little, because that means your body's working a little harder to burn those calories, right? And it's steady rate. You're basically breathing, so it's aerobic style. It helps you mobilize your body fat. So it's fantastic to lean out. So I highly recommend starting with walk, then you progress, but then don't forget about strength training. Like that's like your, I think, investment. That's how I like to describe strength training. It's like
100%.
it's an investment. It's not going to give you results for like if like strength training is not going to help with weight loss. Like it's not going to help you see those drop in numbers, but what it does, it helps you build a lean muscle mass, right? Which okay is now helping you absorb a little bit more glucose. Your metabolic rate is a little bit better, especially if you're going to try to lose weight. And if you can maintain your muscle or even up it a little, you prevent from having that dip in your metabolic rate.
Mhm.
Because even if you lose weight in the most sustainable manner, your metabolism still goes down. So
Yeah.
that's why I say that that's like your investment. But
Yeah.
for
It's a
yeah,
long-term relationship you have to have.
absolutely, absolutely. And PCOS also doesn't go away, right? When you're aging. So once you're hitting your mid 30s and moving into that perimenopausal, oh my God, you need to be lifting weights for
Yeah. I mean,
so
women
many
who don't
reasons.
have PCOS are already struggling once they start at that point.
Yes,
So I could just imagine coming to
exactly.
like the age point. So like with the women who are under 30, under 35, let's say, who have PCOS versus women who are over 35 who have PCOS. Now we know that we're losing muscle after 30,
Bigger
right?
rate.
After
Yeah. At a much
35,
higher rate. Yeah.
even more. So looking at PCOS, when it comes to the training aspect, do you recommend that even women who are above 35, that they should, if they want to go do HIIT training, they should? Because this is a confusion I have myself when I sometimes speak to some clients who do have PCOS with their training. And it's like, I just feel from my experience and
Yeah.
from my knowledge.
What's worked for you, I guess, right?
Yeah, I mean, I don't have PCOS, but I've worked
Yeah.
with clients who do have PCOS,
Okay.
and I've noticed that once they cross a certain age, it like hits leaves them so fatigued
Yeah.
that they're just not able to do
Yeah.
anything for at least 3 days after.
Yeah.
Whereas when they're
Recovery.
in
Yeah.
their under 30, recovery is so much quicker, right?
Yep.
And so I completely switch over to strength training
I love that.
and endurance work in the sense of like
I
lists,
like, and
so long bike
yes.
rides, walk,
Yes.
all of these. But under 30, I'm like, all right, if your life is not stressful,
Yeah, go
go
for
ahead
it.
and do it.
Absolutely. And you will see really, you can lean out really well with HIIT if you're in the younger sort of age bracket. But yeah, when you're getting closer and closer to perimenopause, like your symptoms get even worse, right? Like you
Mm.
have less energy, your recovery's really poor. The rate at which your muscles are growing also it slows down, right? So you have to really fine tune so much. But yeah, I think strength training is like fabulous for women over 35. But alongside that cardio,
Mm.
you need that cardio piece to lean out, especially when all that fat's now getting more and more stored in that midsection when you're over like 35 or you're closer to your perimenopausal
Yeah.
age range.
And it increases your fitness level as well. I mean,
Oh
for
my God.
sure.
Yeah. Because
I
heart
know.
protection, like again, with PCOS, people are so fixated on the weight. But if you really like look at what it does to your brain, what it's doing to your heart health, right? Your bone density. So if you can even like focus on those things and be like, okay, these are my driving factors, it's a lot easier to be kinder to yourself and then also work on yourself at the same time versus like punishing yourself, being like, oh, look, I'm larger, so I have to lose weight. No, let's change what your goals are. Let's change what your, I guess, driving reasonings are, right? And you
Yeah.
just, yeah, if how you talk to yourself matters so much. If you're trying
Yeah.
to change your habits and your lifestyle, you don't want to be a bully to yourself. We
No,
have
and a
enough
lot of
bullies in the
people
world.
are. Yeah.
Yeah, they bully themselves.
People bully themselves for sure. And I think they stop looking at the bigger picture and really asking themselves what's the real why behind their goal.
Yeah,
And this comes down to a lot of
absolutely.
things. Yeah.
I mean, you know this about like women in Kuwait, our mother's friends, or even my mother herself, right? Like she can barely walk,
Mm.
right? She can barely walk. And so for me, like activity and like being fit has a whole different reasoning. I want to be able to still be climbing mountains when I'm like 50, 60. Like that is why I do what I do.
Yeah.
It's, yeah. I think everyone, if they can really figure out, okay, like if you're a parent, like, oh, I really want to be, fit for my kids when they're growing up. I want to be able to travel with them. I want to be able to do things. It's a bigger motivator, I feel.
Yeah, and I think our generation mostly tries their best to do that because we have seen our parents were the other
Oh,
generation who
yes.
just,
Hasn't
they
done
just do
anything.
nothing. Yeah, so I think that's made a big difference. I mean, I have clients whose kids watch them train, and now they start training
I
with me.
love
The kids,
that.
the ones have gotten older,
I
and
love
it's
that.
it's really cool. Yeah, I want to come down to medications.
Okay.
Okay, um, a lot of people just get prescribed birth control when they have
Mm.
PCOS. What are your thoughts on that? Because I don't understand the
So,
concept,
yeah,
and
the
some of my clients,
concept.
for me,
Yeah.
they don't want to. Yeah, because some of my clients are like, I don't want to take it. Like, it's not going to do anything good for me. They're just handing me these birth control.
Yeah. Look, I think all the medical, I guess, system has equipped the doctors with through their medical schooling
Mm.
when it comes to PCOS is these are the two things that you can offer your patients when they come: metformin and then your birth control. And birth control is more popular because if you're going into the doctors and telling them I don't get my period, a lot of times they're like recommending it because they want to make sure that at least like your lining is being shed. It's not a real period, but at least you're not like thickening your lining. So usually every 3 months, like if a client hasn't gotten a period in 3 months, I will tell them, I'm like, go and get your period induced. So go get meds, get progesterone pills, and just get induced, right? But they don't need to be on consistent birth control, because that's, again, the easiest option. But again, doctors, they don't really have much sort of, I guess, education around nutrition or lifestyle. And first line of treatment for PCOS is actually nutrition and lifestyle changes, but no one's going to tell you that.
No,
Like, here you go, so
it's
you don't come
pharma.
back. Yeah, take this and don't come back, right? Like, basically, it's like you
Yeah.
just want a quick fix. And then, of course, with birth control, now there's so much research in terms of like what it does to your brain, how it changes the type of people you're attracted to and get married to.
Is that it? Really?
Yeah, it's so interesting. Yeah, look into it. It is so interesting. It
I've
really
never
changes.
taken it, so I have no clue.
Yeah, I know. I read about it, and I've been seeing a lot of research on it. It changes, of course, your gut bacteria. There's so many like nutrient depletion that happens on long-term birth control pills. There's so much.
But
So
come
now,
back to the changes who you're attracted to. That caught my
it's so,
attention.
yeah, I know. It's so interesting. It just changes like hormonally, like it changes your brain chemistry pretty much. And yeah, you need to look into it.
I will.
It's so niche. And so, yeah, a lot of women now are being more aware of like all the side effects. So they're refusing to take it, right?
Yeah.
Metformin, again, there is a place for it. There is a place for it in situations where like your diet and other changes are not helping, because it just helps the cell work a little bit better. It helps you open up a cell, your glucose can move in that sense, right?
Mm-hmm.
But you can do that. I would say majority of my clients they don't take metformin, because we're able to figure that out with the dosage of the carbs and all of the other factors. So that's the most common ones. And now there's the GLP ones too, right?
This was the next thing I was actually going to come to. GLPs with PCOS.
Again, there's room for it. I'm not like against anything. It's a personal choice. There are times when there are clients with so many health concerns where their blood sugars is just not even insulin resistant anymore. It's out. You're in diabetes mode, right? You're finding it really hard to lose weight. Now the weight is causing issues on your joints. Your quality of life is suffering, right? There's so much going on. In that case, GLP-1s can be a great addition for them, right? And again, there should be no shame around meds. It's just, how are you utilizing them? If you're just dependent on meds because you think it's a quick fix, that's a problem. But if you think that, oh, okay, I still need to prioritize my protein, I need to understand how to preserve all my muscle mass. Because again, with GLP-1s, you lose weight, a lot of that is muscle mass.
Yeah.
A lot of that is muscle mass. And it's like forever. It's a long-term drug, right? So you need to prepare yourself that, okay, is this what I want? Am I okay with being on these drugs long-term? Like Mounjaro is tolerable, is slightly better tolerable, but like Ozempic, the amount of people who have like pancreatitis from it, so many.
But aren't GLP-1s supposed to help with insulin resistance?
Yeah, but it damages the thing with these like Ozempic and stuff. They damage like the organs quite a bit too, because God knows why. But there's that. Yes, improves insulin sensitivity and stuff, but all your organs don't respond
Properly.
well to it. Yeah, exactly. So and yeah, like even with supplements, right? Like it can damage liver if you don't know how to take certain supplements, like berberine. People like just take it over and over and over again, but they don't know they need to like stop it for a certain amount of like months before they resume it, because it's really heavy on the liver. Same thing, meds. They're going to cause issues with your organs. So you gotta like just weigh the pros and cons and see what works for you. Again, it's so new now, and we'll only know truly the issues with it. And obesity is a chronic disease, so if there's a medication for it, then why not?
Why not?
Why not? But not for people who are just. There's so many people who are just taking it because they don't have obesity as a disease.
It's just a quick fix.
It's a quick fix, right? And we know the Middle East is like, they hand it out like candy. You can just
It's
order
not just
it.
the Middle East. I mean, I also work with some people in India, and it's quite
India too. Yes.
It's become just like, oh yeah, I just didn't do anything for 2 years, and so I decided, like, I've gained this 15 kilos, and I'm just gonna take it. And I went to a doctor, and my doctor prescribed me, what was it, 5 mg, and I lost like 6 or 7 kilos within the first week, and
great. And now you're gonna gain it back.
Bye-bye muscle, bye-bye muscle, bye-bye muscle.
Yeah, goodbye. I mean, remember when bariatric was all the craze in the Middle East? I was working there at that point, and I worked in the bariatric clinic. And they were doing it left, right, center. They weren't even following the guidelines that were set by WHO. So anyone who wanted to do bariatric surgery were okay. They
Yeah.
weren't getting proper counseling. Or like for dietitians, they didn't even come to us. They didn't even care. They didn't do nothing. So no psychological screening, no ongoing follow ups, nothing. Literally, majority of them would come back after a year because their stomach stretched back to the original
Of
size, because
course.
it's a muscle. It can stretch back. It can shrink, but it can come back. So if you even cut it into this little ball, it's now grown back and you gain all the weight back. Same thing with meds, right? If you just stop it, or
It's
you
all
haven't done it in conjunction with nutrition, lifestyle, like really build that muscle mass, prioritizing that protein, you're going to first need more and more dosage. Like your dosage needs to keep increasing, or you can keep a minimal dosage to just keep that blood sugar stable, but still keep working on your muscles, right? So you could do it both ways. But which
yeah.
one's going to be better, right? Having a little less doses, I would say, would be a little bit better with getting the benefits of the insulin sensitivity.
Yeah, definitely. I mean, I've actually realized the amount of people that are on it now, and of course, a lot of people don't say that they are, but a lot of people are on it. And it's also come to my attention, when I went back to Kuwait this time, and I went
Yeah.
to the gym, and I was working there to see people I've seen for so long
Yeah.
suddenly
Yeah.
just become so skinny, and
Mm-hmm.
like that they're on it. And again, no hate. If you want the easy
It's fine.
fix, that's fine. You're still going to the gym, great. But I see a lot of people also who are doing that, but then they're not doing it in the right way, because I feel like when you want to make this decision, like you said, when you're doing, whether you're doing the bariatric surgery or anything, when this decision, I think for this injection is even bigger than that, because that, they cut the stomach will grow. With this, you're
Yeah.
losing a lot and you're
Yeah.
damaging a lot.
Yeah.
And people don't think of what's going to happen. They want to lose the weight. They take
Now.
the
Yeah.
injection, and then they realize this is happening. Muscle is going down. Strength is going down. I don't have the energy like I do. Now I'm going to call a trainer or a nutritionist or whatever.
Yeah. Yeah.
And I just want more people to understand that if you
It's
have made
supposed
this
to be.
decision,
Yeah. Do it
great.
simultaneously.
Find somebody who's going to help you make sure that you do it correctly
And safely. Yeah.
and safely.
Absolutely.
Exactly. I think that's the most, and I think that's missing. I still see so many trainers and nutritionists out there like bashing GLP-1s.
No, there's room for
And
it. There is room for it, because sometimes, again, if it's a chronic disease, just like mental health, you can't just be like, no, do better, like meditate more. No, you need
exactly.
medication for
Yeah.
mental health, right? Same thing.
It's like I see people saying you're just lazy, you haven't did you put in the work for at least this much?
Oh,
And it's like, okay, this
shaming
person
people.
doesn't
Yeah.
want to put the work in, and that's fine. But maybe now when they start, some people, it's motivation to see the weight drop.
Yeah. And they're like, oh,
If they start
okay.
seeing the weight drop, then they're
Yeah.
like, you know what? I'm gonna start now, and I'm gonna train, and I'm gonna make sure I keep this. There's your motivation. So yeah, I just think there's too many people hating on it, and I was a bit like, and now I've come to the side where I'm like,
Yeah. It
I'd
takes
rather
time
help.
to form your, like, what, yeah, it takes time to form your opinion on these things, because
Yeah,
they're still, like, you're seeing so many different.
exactly. But I've decided that I want to be that person who's going to help somebody do it in the right way.
Yeah.
And I think that's super important, that people need to have that with so much hate, because then people are afraid to tell anybody as well.
Yeah. And reach out for support. Yeah, absolutely.
Yeah.
Yeah.
Okay. So women with PCOS, are they at a disadvantage in any way, or is that just a
I
mindset
don't
that
want to say
we
they're not, because then people who have been struggling for so long, they'd be like, what the fuck have I been doing?
yeah.
Right. But okay, I'll give you an example. So I work with women who have PCOS, yes, but I also have clients who just want to lose weight. They don't have PCOS.
Mhm.
And no matter who's coming to me, I still tell them that my program, if you're going to work with me for the 3 month or the 6 months, whatever, the average weight loss you can see is 0.5 pound to 1.5 pounds. You're not going to see more. You're not going to see less, because I'm so tight on my calories. I want to make sure you're eating the max with
Mm.
that slight deficit. And I'd say women with PCOS are able to hit that target. The reason I feel like they both see that, whether you don't have PCOS or my clients who do have PCOS, is because now they're not doing a trial and error anymore. They're not
Mm.
just trying all these different things and cutting this, cutting that, or trying this, trying that, because you lose momentum when you have to start, stop, start, stop, start, stop, start, stop,
Yeah.
right? And they're sick of like doing this trial and error. So when they work with me, they know I'm doing all the back end work. They know their goal is just doing their food planning and prepping and things like that, which also I support them with. But once you have the right equation, it's repeatable. You don't need to keep
Yeah.
changing anything. Once you get that perfect ratio for yourself, you're good. You just
Yeah.
need to then, again, it's more about behaviors around, oh, I work on the road and that means I don't take my lunch. Okay, let's figure out what can you pick up on the road. So it's all those like customizing those habits for
Mhm.
your lifestyle,
Yeah.
right? People who are work shifts, right? That's going to be a little bit different. But overall, once you figure out how to do life and food for you,
Yeah.
it's repeatable.
Yeah. It's just about being able to be consistent though, isn't it?
Yeah, exactly.
Yeah.
Exactly. And I guess like when you're not, again, when there's a smart way of losing weight and a smart way of so-called dieting versus where you you restrict yourself and you're miserable in that journey. So it's very
Hmm.
hard to keep going. Whereas
Yeah.
when you have your certain amount of carbs that you need to eat, you know, oh, okay, if I want to eat rice twice a day, lunch and dinner, I know I can do it, no problem, because I
Mm.
know the amount I need to eat and I know what else needs to come with it, blah, blah, blah. So it's easier. The journey is a lot more pleasant. My clients would, on average, would eat out at least 2 times. And it can be fast food too. They don't always eat like the most like nutrient dense foods because that 1 or 2 times of like processed food is not going to do any damage,
Yeah.
right? Because overall your habits are very aligned. And yeah, it's
Yeah.
also the less stress aspect of not being like having food, like fearing food when you're eating, which again, I think it can sound woo woo. It can sound really woo woo, but when you're sitting down and you already are so like in this stressful situation, you're not going to digest your food properly. You're not
No,
going
but
to be
that's
able to
true.
absorb.
That's your
Yeah,
parasympathetic
you're
nervous
not
system.
exactly. You're not going to be able to absorb like your nutrients better. And you know how like you've come across these things where people like, oh, if don't sit down and eat with people you don't like because that food doesn't like your
I've
food
never
is.
heard that, but
Yeah,
okay.
yeah. It just talks
What
about
is the
how
line?
it's
What's the
like
saying?
don't sit down and eat meals with people you don't like or you know that you don't that you don't get along with because there's again this you're on this high alert, you're on like you know you're just on the edge, and when you eat that food is not being digested properly or metabolizing properly. So
Yeah.
I believe that stuff quite a bit. I'm like I think you need to have a good environment because again that plays a huge role in how your body is. Inflammation is also really driven by just having poor relationships. It's not just food.
Yeah,
If
of course.
women who are married with like the worst spouses or have really bad toxic home environments, doesn't matter what they're eating, they could be eating the best thing and they would still have like autoimmune issues, they still
Mm.
have inflammation. So yeah, so I'm big on that, just being a little bit mindful of like the environment you're creating for yourself during this process.
Yeah. Yeah. I mean, overall, I think in any case that makes a big difference. Like PCOS, no PCOS, thyroid, no thyroid. I think
Yeah.
it's all comes down to that, and this is why I don't believe that generic one size fit all
Yeah.
coaching works, and I especially when it comes to women.
Oh yeah.
Like I think men is more of a straightforward. You see
Yeah,
the
it's very
stress,
yeah,
yeah.
agreed.
Yeah, I mean, training men is great. Like
Yeah.
I do, I work with men, and wow, like the results are just like
Yep.
boom. You just say, okay, I want to lose X amount, and you just hit this calories, boom, done,
Yeah, done.
great. And then
Exactly.
women, we've got fluctuations, all the
Yeah.
time.
Also,
Things are,
just how women are in society too, right? Because there's so much
Mhm.
more load on them in
Yeah,
terms of like family life, taking care of the kids, maybe even working, cooking meal. That there's so much more that women are sucked into versus that, I mean, I don't want to generalize. There are men that also
yeah,
put in, yeah, but I would say the norm is generally women have
yeah,
a lot more on their plate.
yeah. And I also think we have a lot more things happening with hormones
Oh,
on
in our
our
body. Yeah. Our
cycles and
cycle.
everything.
Absolutely.
So
Absolutely.
men
Exactly.
don't have
So
that.
yeah, men can, yeah, again, with like even fasting, right? Intermittent fasting works so well for men.
Hmm.
Excellent. I recommend it. Go for it. For women, I'm like,
Yeah,
not really, right? Again, short term, like in Ramadan when you're fasting, that's okay. It's short term. It's a very
yeah,
short term plan. It's not like long term. So
yeah.
again, you don't see those side effects when you do it for short durations.
Yeah. Okay. Well, if someone with PCOS listening right now is feeling defeated and just does not know what to do, what are the first three things that you think that they should do this week? If you had to give them some advice.
Honestly, I think just when you've tried to do so much and you've been on that on mode where doing this, take a step back. That's all I'm going to say. No, take a step back. Just give yourself a time, like give yourself a break from all of this, like constantly having to like even like looking for help, right? On social media, we just keep scrolling. People are like, oh, let's information overload, right? Trying to
Mm,
find a solution. Guess what? You're creating more stress for yourself. So just take a step back. I would say first work on just regulating your emotions. If you're in a really bad place mentally, I would say you want to first work on regulating your emotions and just feeling safe. And again, being kind to yourself and just really assessing how have you been treating yourself and the dialogues you're having internally, right? So is it helpful or is it the bully in you, right? So I
mm,
really say start there first. And then once you can get some clarity and you create a little distance from having to fix this, then you can start. Your first step is just starting with like simple changes, looking at your diet, being like, okay, am I eating enough of the good stuff? Forget about what you need to take out. Can you think about things that are not really part of your diet that you could potentially try to include? How's your protein intake? Are you eating enough protein in all meals? Okay, let's start there. With carbs, how about we choose carbs that have a bit more fiber because your fiber could be low, right? So just starting with small things. I really liked even what you said. Just start with vegetables, just start with salad. Just start your meal with a bowl of greens or some sort of veggies before you start your meal. And eat whatever you want at the beginning, right? Like whatever you
mm,
usually do it, but just start changing that one behavior.
mhm.
Just salads, right?
Yeah.
So start with small things, and it gets easier when you kind of build on little things versus having to do 20 different things and be like, oh shit, I got to be perfect. You're going to be so like fatigued at the end of this journey.
Yeah, I think a lot of people tend to actually do that when they decide they want to change.
Fix
They look
everything.
at everything that they need to
Yeah.
change and they try to tackle everything at one time head
Yeah.
first rather than these small changes,
Yeah.
which is
Yeah,
going to
honestly,
make
like
it
if you
much
pick
easier.
all the different, I guess, umbrellas, right? So I mentioned, okay, work on your nervous system and your emotional health. So that's one item that you're doing from that
Mm,
department. Okay, for nutrition, you don't have to do five things. Be like, okay, you know what? I'm going to commit to just eating vegetables at lunch and dinner before I eat my main meal. Okay, that's another. The third could be in the movement department. Okay, I'm going to start walking 30 minutes every day. Can we just start there? Just see how far you go in a month. I can promise you will see changes. Like, I can promise you there will be changes, right? You don't have to go the complete, yeah, extreme.
So they are not broken. They have
Absolutely
PCOS.
not.
Yeah, I think people tend to just think that they
The
are.
messaging of broken. Yeah, I mean, your symptoms are like a communication. Your body's trying to communicate with you. That's all, right? It's just telling you that something's not right. You need to look into the hood and be like, okay, what am I not doing or doing that's causing these things? Like, are you under eating? Are you skipping meals? Are you on your phone before going to bed? Are you, right? Like, are you getting sunshine? Like, look at all of those basic foundations because they will not fail you. I know they are boring and unsexy, as we call it in social media,
Mm,
unsexy habits, but they work because they're the foundation of your health.
yeah, no, it really is, and I feel like these little things, when I have conversations with my clients, they're like, yeah, I've been really
I know.
stressed and I'm just
Yeah.
not sleeping well. I'm like, are you on your phone before bed? Yeah. Can you stop it? But it sounds like such silly advice.
I know. Sometimes coming out of your mouth, you're like, this is
Yeah,
what you're
you're just
paying
like,
me for. It's the
yeah, but
accountability aspect,
it's the
right? Just, yeah.
actual thing that's going to help you sleep better.
Yeah.
It is what it is. I mean, sometimes I end up, especially with these Epstein file things coming out,
Oh
I'm
my
on
God.
my
I'm staying
phone.
away from it. I'm so,
I
I
stopped
I
now.
can't do it.
I stopped because I realized I was staying up like on my phone
Yeah.
and then I'm waking up so exhausted. I'm not
Yeah.
eating properly and this whole, this horrible cycle starts.
It
So
starts. Yeah.
it starts and it affects everything in the day just from that, spending that one extra hour on my phone
Yeah.
at night. It affects everything for the rest of the
Yeah,
day.
everything is connected, right? Like not sleeping well will then affect like your cravings and stuff in the morning, and like again your energy during the day. What you do during the day will affect your sleep.
Yeah,
It's vice versa, right? So I,
everything.
yeah, exactly.
Yeah. Awesome. Well, thank you so much for
Pleasure.
jumping on this call with me and coming on the podcast. Like
My
I've really wanted
pleasure.
to get you on. You
I
should have
really
been
wanted to be on
yes.
here too. Yeah.
But anyway, you're the first guest of
I'm
season
glad.
3. So I'm super happy about that. Yeah, and I guess we'll speak soon. Thank you.
Yes. You will. All right. Take care. Bye.
Bye.